back. Good morning.
Morning.
I'm Summer. I'm going to be your nurse today. Can you give me your name and date of birth?
Gloria Smith, January 17th, 1997.
Perfect. And Gloria, this morning I'm just checking in because I want to get in touch with how you're feeling after the surgery you just had. I know that there was an extensive surgery on your spine, so I want to get a good picture of your pain level and how you're doing as far as pain. So the doctor did administer some pain medication that should be kicking in pretty soon here, but I do want to ask you a few questions regarding the pain.
Okay.
So we have this pain scale, and it's rated from a scale of 0 to 10. 0 being you're not in any pain at all, you're totally fine. In the middle, it kind of starts to get like you're trying to scratch an itch and you can't be satisfied, and then it starts to get worse from there up to 10, and 10 being the absolute worst pain you've ever experienced and you need to be in the ER basically. On a scale of 1 to 10, what would you rate your pain right now?
Well, I'd probably rate it a 7. I don't think that the pain meds have started working yet.
Okay. And we can talk to your doctor about adjusting that dosage, and then I will also, in a little bit here, explain some other things that we can do for your pain besides the pain medication. So for now, when would you say your pain began?
I woke up with it after the surgery.
Okay.
Yeah.
Where are you feeling your pain the most right now?
So in my back, and it feels like it's going down my legs.
Okay.
Yeah.
Okay. And it's mainly your lower back, or where?
Yeah.
Okay. Both legs? Is it going down both your legs? Okay. How long have you been experiencing the pain?
Just since I woke up. Yeah.
Okay. Has it been coming and going, or is it constant?
It's constant. Yeah.
Okay.
It just hurts.
Yeah, and I'm sorry to hear that. That is expected after a surgery, but we do want to mitigate the pain as much as possible, make you as comfortable as possible. That's our goal. How would you describe your pain? Is it aching, burning, throbbing?
I would say it's pretty close to all of those things. I have tingles in my toes and my feet.
Okay.
Yeah.
Do you feel those tingles going all the way down your legs, or is it just isolated to both of your feet and toes?
I think it's like the bottom half of my leg and my feet.
Okay.
Toes.
Okay. Has anything helped for your pain so far?
Not really.
Okay.
I haven't seen much of the doctor.
Right. Okay.
So,
Yeah, and he'll be coming in shortly doing an assessment because you did just come out of surgery not too long ago. So the pain will be most ramped up probably right now. Is there anything right now that makes it worse? Maybe your positioning or anything that we've done that's been making it worse?
Not really. They've told me just to relax and just lay right here until the doctor comes in, and
Okay.
so I just been staying like this, and it's been pretty persistent.
Okay. And we can try some minor position changes if you feel like you're not in a comfortable position as well in the bed.
Okay.
Over time, we will be getting you more mobile as well, but we'll talk about those goals a little bit later as we go. And then we already talked about your severity of the pain. You said it's a 7 out of 10 right now?
Yeah.
Okay. So now I will go over some other techniques that we can help you with as far as your pain. So one of those is, I have some essential oils here. There's many different kinds. They all smell very nice, and then this is a base oil that you would dilute each of these oils in, whichever one you choose. What you can do is you can mix those up a little bit and then have someone put it on that pain site, rub it around that area, and maybe do some light massaging. The idea is that it will relax you and it will relax that area, maybe even get some blood flow to the area and make sure that it's maintaining perfusion. And then another one is, this is called called a TENS unit.
Uh-huh.
And what this does is it stimulates your muscles and
Okay.
sends electrical impulses throughout your muscles, basically distracting your brain from the pain.
Oh.
And so if you think about pain as being a gate that's either open or closed, you can't get through a closed gate, of course, so if you have other distractions or relaxation techniques, that will close the gate, and so those pain signals can't reach your brain and you won't feel the pain as much.
Well, that sounds nice.
Right, and so we do want to try to implement those as much as possible so you're getting more relief than just from the pain medication.
Okay.
So as far as the non-pharmacological techniques, how would you, do they make sense? How would you describe those back to me if you were to do it or do it on someone else?
Okay.
We can just do the oils for now.
Okay. I would take the oils, whichever one I wanted, and mix it with the other oil,
Mhm.
and then have it massaged on my back, on
Perfect.
the muscles,
Mhm.
not
Right.
on the incision.
Preferably no. We want to stay away from that incision site for now, but just kind of around that area or even other places, and the idea is that it's just relaxing you.
Oh, that sounds nice.
Right. And then as far as the TENS unit, I know that one's a little bit confusing. Did you have any questions on that, or would you be able to describe how you use it?
So you put it, the little patches,
Yes. Mm-hmm.
and you put them on the back, kind of like, is that like one of those things where they check out your heart?
It's similar to that. Mm-hmm. Yeah, you're putting those patches on around the pain site, not directly on the spine.
So kind of like where you would put the oils.
Yeah, exactly. Mm-hmm.
And then it relaxes my muscles.
Mm-hmm.
And
Yeah, it sends a electrical signal through your muscles and kind of causes a distraction at those sites for your brain.
Boy, I could sure use a distraction right now.
Yes, and we can help you get those distractions. One last thing we can do super easy is either heat or cold.
Okay.
So start with cold treatment on the site. We don't want to use heat yet because that area is trying to heal. There's already a lot of inflammation and swelling in that area. So if we use heat, that kind of promotes those same characteristics. But if we use cold to start, it'll constrict a little bit of the blood flow, allow some numbing so you're not able to feel that site as well. It'll cause some numbing. And then in a few days we can use some heat and that will help relax the area once it's healed a little bit more.
Okay. Can you use those things together, like
You
the
can,
ice and the
yeah,
one of the others, or
yeah, you can eventually. Again, I wouldn't do the heat for you yet, but down the road you can switch back between heat and cold, and that actually does promote healing and some relief.
Okay.
Okay. Any questions?
When can we start?
We can start right now. So I will check in with your doctor. We'll make sure the pain dosage medication is working for you, and then we'll start with some essential oils and see how you like that.
That sounds great.
Okay. Well, we will check in a little bit. I'll give you your call light here. Just press this button if you need anything.
Okay.
And I'll check on you in a few minutes.
Thank you so much.
Of course.